Nurse Mary, you've talked about fibroid, you've talked about the various types of fibroid. Could you please talk about the various treatments of fibroid? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my viewers. Today we are going to be talking about the treatments for fibroid. There are some treatments that are meant to treat the symptoms of the fibroid, while other treatments can help shrink that fibroid. For those asking, do fibroid show signs and symptoms? And also, does fibroid goes after menopause? These are the questions I'm going to be taking in this video. But before we go into details into this class, if you are new on our YouTube channel, please click on the subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be talking about the various treatments for fibroid. For those that have not watched our video on what fibroid is all about, the causes of fibroid, the types of fibroid, I'm going to be dropping the link in the description box below so you have access to this video. This video is more or less like a continuation of what is fibroid. So if you've not watched it, I would advise you pause, go back and watch what fibroid is, then come back to this video fully. But before I go further, I want you to know that fibroid may be asymptomatic in some individuals. Fibroid may be asymptomatic in some individuals. That simply means that some individuals might not show the signs and symptoms of fibroid that you see. Some individuals might be having fibroid and they don't know they are having fibroid. And also, I want you to know that fibroid may not require treatment. As far as not disturbing your normal activities, as far as not taking away your strength, as far you can carry out your normal activities, you might not need to treat that particular fibroid, because as age goes, as you get into menopause, it shrinks on its own. For those that ask, does fibroid shrink with menopause? I believe I've answered you. During menopause, the fibroid tends to shrink on its own without treatment. Then that takes us to the various treatments of fibroid proper. The first one I'm going to be talking about are treatment that helps to treat the symptoms, treatments that deal with the symptoms of the fibroid. After that, I'm going to be explaining the treatment that shrink the fibroid. So first of all, we're going to be talking about what? The treatment that treats the symptoms, the treatment that treats the symptoms of the fibroid. So the first line of treatment that helps to treat the symptoms, that helps to deal with the symptoms of fibroid is levonorgestrel intrauterine system. Levonorgestrel intrauterine system. This system is a T-shaped device. It has a T-shape. It is placed inside the womb of a woman. When it gets to the womb of a woman, it releases this hormone, this progesterone hormone, levonorgestrel. That's what this T device releases. So when it releases this hormone, what it does is that it stops the lining of the womb. You see that womb, that uterus, it stops it from growing quickly. You know, fibroid is an abnormal growth. So when that progesterone is being released, that levonorgestrel is being released, it stops the lining of the womb from growing rapidly, from going fast. So it becomes thinner, and the blood you see and the bleeding you see becomes lighter. There are side effects associated to this treatment, such as you might be having irregular menses, there might be absence of menses, there might be breast tenderness, this person might be having acne. So these are the side effects that are likely going to be associated with this particular line of treatment. And I also want to let you know that this particular line of treatment can be used as a method of contraception, that it can be used to help you prevent pregnancy, but it doesn't affect fertility. When it's removed, you can go back to your normal fertility and you can give birth. Just know that the mechanism of action, in summary, of this particular line of treatment is that it stops the lining of the womb from growing quickly, thereby making the blood you're seeing thinner, thereby making it lighter rather than being heavy. The second line of treatment that helps you to deal with the symptoms associated with fibroid is known as the tranexamic acid. The tranexamic acid is a tablet. It's a tablet that is taken 3 to 4 times a day during your menses period for like 4 days. This tranexamic acid, what it does is that it helps to clot the blood. When it clots the blood, it reduces blood loss. One thing about the tranexamic acid is that it does not affect fertility. It's not a method of contraception, so you can get pregnant while using this, unlike the levonorgestrel intrauterine system. And the side effects associated with tranexamic acid is feeling sick and diarrhea. So that is the second line. Then that takes us to the third line of treatment that helps to deal with the signs and symptoms associated with fibroid. The last line of treatment that helps to deal with the symptoms associated with fibroid is the oral progesterone. What do this oral progesterone does? The oral progesterone is taken orally, which is through the mouth. What it does is that it prevents the uterus lining, the womb lining, from growing quickly. It prevents them from growing quickly. Though it is not a method of contraception, but it might reduce your chances of giving birth to children, of getting pregnant at that particular moment of taking it. There are some side effects associated with this oral progesterone, which include weight gain, breast tenderness, and also irregular menses. Then the next line of treatment is the injected progesterone. As the name implies, injected progesterone. It has the same similar mechanism of action with the oral progesterone. What it does is that it still reduces the chances of the womb lining growing quickly. It prevents the womb lining from growing quickly. And the side effects associated with it include that similar to the oral progesterone, which is weight gain, absence of menses, irregular menses can also pop in. Then another line of treatment that helps to deal with the symptoms is the contraceptive pill. This contraceptive pill, they prevent the ovaries from releasing eggs, and they might help to make the bleeding lighter, and also help to treat the symptoms associated with fibroid. So these are the various treatments that helps to deal with the symptoms, that symptoms of bleeding and pain. These are the treatment that helps with it. Then that takes us to the other treatment that helps to shrink the fibroid. The type of treatment that helps to shrink the fibroid, the first one I have to share with you here is the gonadotropine releasing hormone analog. Gonadotropine releasing hormone analog. What it does is that it works on the pituitary gland. So when it works on the pituitary gland, it stops the ovaries from releasing this estrogen. Remember, we said we associated estrogens to fibroid formation. So when it works on the pituitary gland, it stops the ovaries from releasing estrogen. And when this estrogen is not released, it definitely indirectly helps to shrink this fibroid. There are some side effects associated with it, which include vaginal dryness. It also includes night sweating, hot flushes, and muscle stiffness. So this can help you ease that heavy period that you feel while you're having fibroid, and also those stomach upset that you get. There are medications, there are line of treatment that helps to shrink the fibroid. Another line of treatment that helps to shrink the fibroid is the Ulipcrystal acetate. I'm going to be dropping the spelling so that you know the spelling on your own. So this particular type of treatment is prescribed on occasional use. They don't just prescribe it anyhow. Doctors don't just prescribe it or tell you to go and take it anyhow, because there is a higher risk of getting a liver damage with this medication. So there are some conditions that should be taken into consideration before they give you this particular prescription. Generally, all these medications I've listed about shrinking fibroid, treating the symptoms of fibroid, you are not going to take it alone without your doctor's prescription. Please don't take it alone without your doctor's prescription. You have to see your doctor, you have to see your GP, they have to do some tests with you, they have to know what is wrong before they help you prescribe it. I'm just only teaching you so you have an idea of what your doctor might say. But don't take these medications that I've listed or the treatment I've listed without the doctor's prescription or without the doctor's guidance. Then the last form of treatment I would like to share with you is the surgical treatment. The surgery can help you remove this fibroid, and it is done by a doctor. It's not done by anybody or individual. It's actually done by a doctor. We have the myomectomy and we also have the hysterectomy. The myomectomy and the hysterectomy. So myomectomy and hysterectomy, they are the surgical approach when it comes to fibroid. Myomectomy simply involves removing the fibroid, while hysterectomy could be total hysterectomy, simply means removing the uterus, removing the womb. But in all, the major purpose is just to treat the fibroid. Generally, like I earlier said at the beginning, fibroid might not require treatment, especially if you are not showing signs and symptoms. There's no need to treat it. If you are not showing signs and symptoms, it's not affecting your activities of daily living, there is no need to treat it. Just wait. After menopause, it shrinks on its own without you bothering yourself, without you disturbing yourself. So these are the various type of treatments that is being approved to treat fibroid. Please and please don't go ahead to start looking for these medications in the pharmacy. Nobody's going to give you. You have to take these medications, this line of treatment, with the guidance of your doctor. Your doctor has to prescribe it. And I'm just here to teach you, to have an insight, to give you an insight on the various treatments, not to tell you what to do per se. You get? So this is just a health educational video. Yes, a health educational video to enlighten you about the various treatments of fibroid that you may likely get in your hospital facility. I hope this video is actually beneficial to you. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye and see you in our next video.